Teenage angst, troublesome teens, temperamental teenagers. These are just some of the words we use to describe the many issues that take center stage during teenage years. Well, it's high time we stop doing that. Because young people's mental health is getting worse. There's a crisis in teen mental health. A UK study, the largest of its kind on the subject, says that schools can't seem to figure out how to improve adolescent mental health. There's no one-size-fits-all approach, finds the study. As children are now heading back to classrooms after more than 2 years of lockdowns, they're tackling multiple issues. And we need to pay closer attention. Here's why. Exam stress, weekly tests, holiday homework, summer camp, making friends, breaking up with friends, social pressures. There was once a time that teenagers were branded hormonal, angry and temperamental. As adolescence beckons, we start using different words to describe children. We peddle the same narrative handed to us by our parents. With puberty come hormonal changes. It'll pass, we say. Social media is eroding moral values, we say. Yet, we arm our kids with the latest gadgets on the first request. And if they stop talking to us and spend hours on their handheld devices, we blame ourselves. But we need to pay closer attention because there's a crisis in teen mental health. And schools and universities may be ill-equipped to handle adolescent mental health issues. A UK-based research project, the largest of its kind on the subject, has suggested that mindfulness training in schools may prove to be a dead end to tackle teenage problems. Since there is no one-size-fits-all approach to deal with students, mindfulness training is a method applied across the United Kingdom where children are trained to pay attention to what's happening around them, what they're experiencing in the moment. It involves teaching children to manage their feelings and cope better with stress. The same goes for adults too. But it seems that the approach is not working for all teenagers. This is what the study says. Now, this is a worrying prospect for students across the world who spend most of their day in school, in extracurricular activities or extra classes. While mental health awareness has been rising in the last decade, it was the pandemic which brought mental health into the spotlight. A recent study by the US Centers for Disease Control and Prevention suggested a significant rise in mental illness, sadness, and teen hopelessness. While the report left experts wondering if it was the pandemic which was the root cause of these issues, or if it merely brought them to the surface, whatever the scenario may be, it is evident that teens across the world are struggling emotionally. According to recent CDC data, 37% of American teens said that they had poor mental health during the pandemic. Meanwhile, in England, recent figures show that a record 420,000 children a month are treated for mental health problems. In India, 1 in 7 Indians between 15 and 24 years feels depressed or lacks an interest in doing things. This is what a UNICEF report from 2021 said. Globally, WHO figures from 2021 show that 1 in 7 10 to 19-year-olds experiences a mental disorder. So are schools following the wrong approach in dealing with adolescent issues? Well, not necessarily. Experts in the UK are saying that schools should continue mindfulness training, but be aware of the fact that each child is different. Educationists must gauge how each child responds to such methods. Factors like deprivation and inequality also need to be taken into account. Simply put, what works with one child may not work with another. We must continue to establish a rapport with our children and speak to them about their feelings. This is what experts say. They are our future, after all. Else, we will have a bigger crisis at hand. Bureau Report, WION World is One. WION World is One is now available in your country. Download the app now and get all the news updates on the move.